Welcome to this explainer. Look, if you're working in a vet practice today, you already know that vaccines are literally one of our best tools for keeping dogs healthy. But as the 2022 AHA Canine Vaccination Guidelines point out, there is this growing wave of vaccine hesitancy in the human world, and wow, it is absolutely spilling over into our exam rooms. It's incredibly frustrating, right? You know a preventive treatment is safe and necessary, but you just hit this brick wall of client doubt. Well, today, we're going to bridge that gap. By the end of this session, you and your team are going to have a solid, evidence-based communication toolbox drawn right from the latest guidelines.
Here is our roadmap for today. We're looking at the Vaccine Hesitancy Challenge, explaining core versus non-core, framing vaccine safety, a quick kennel cough case study, and finally, the herd immunity shield. Let's jump right in.
Section 1. The Vaccine Hesitancy Challenge.
So it is absolutely valid to feel a bit frustrated when pet owners push back on routine care. I mean, you went to vet school to practice medicine, not to be a pushy salesperson. So how do we actually talk to hesitant clients without getting defensive? The secret here is scripting. By equipping ourselves with clear, really empathetic answers ahead of time, we can pivot that whole conversation away from a debate and turn it into a collaborative care plan. We want to give you those exact talking points to explain why core vaccines are so crucial to folks who are just on the fence.
Let's start with a really foundational piece of advice from the AHA guidelines. For dogs with a totally unknown or sketchy vaccination history, which happens all the time with rescues, the golden rule is literally, when in doubt, vaccinate. You can look the client in the eye and warmly say, because modern vaccines have such a proven track record of safety, the benefits of making sure your dog is protected right now far outweigh the incredibly low risk of over-vaccinating. That script right there, it establishes your authority and gives them huge reassurance.
Section 2. Explaining core versus non-core.
You know, a big reason clients get so hesitant is they just feel overwhelmed by the sheer number of shots. But check out how visually structured the AHA guidelines are here. By actively breaking down vaccine types into core and non-core, we really simplify the science. When you show them a framework like this, it proves you aren't just giving every vaccine under the sun just because. You're meticulously separating the absolute, non-negotiable lifesavers from the lifestyle-driven options.
Core vaccines like rabies and parvo are recommended for all dogs, period. Non-core ones, though, are based entirely on geography and exposure risk. So, try this script in the exam room. Core vaccines build a vital public health shield for every single dog, while non-core vaccines are strictly tailored to your dog's unique daily lifestyle and where we happen to live. See what that does? It makes the client an active participant in assessing their own dog's risks.
Section 3. Framing vaccine safety.
Okay, we have got to address the elephant in the room, safety. Hesitant clients are usually just terrified of adverse reactions, but the guidelines are crystal clear. The benefits far outweigh the risks. Take the lepto vaccine. Historically, folks worried about it, but modern formulations have dropped reactions to insanely low numbers. We're talking less than 53 adverse events per 10,000 doses. That's incredibly rare. So your script goes like this. I totally understand your concern about reactions, but modern vaccines are exceptionally safe. The real-world risk of your dog catching the actual disease is far, far more dangerous than the extremely rare chance of a reaction.
Now, to explain the why behind our protocols, it's super helpful to translate the concept of duration of immunity, or DOI, for your clients. When they ask why is lepto an annual booster but parvo is every 3 years, you can explain that we aren't just guessing. We are following the exact biological timeline of the protection. Different vaccines produce a robust shield for different lengths of time. This totally demystifies the schedule for them.
Section 4. The Kennel Cough Case Study.
Sometimes, abstract stats just aren't enough to sway someone. We need to ground this in reality, and a case study is perfect for that. Ask your client if they've ever actually heard the classic goose honk cough of kennel cough. Describe it to them, that harsh, persistent, honking cough that almost always ends in a gag. Remind them how absolutely exhausting it is for a beloved pet to be unable to sleep because they're constantly coughing up foam. It is an awful experience, and the crazy part is it's largely preventable.
So, how exactly does it spread? This is your go-to when a client says, "Oh, but my dog just stays indoors and in our backyard." Well, kennel cough is highly contagious. It spreads through airborne respiratory droplets, direct contact, even shared water bowls. Sure, boarding kennels and shelters are high risk, but so are doggy daycares, the groomers, and the local dog park. Honestly, if their dog ever visits a grooming salon or even just sniffs a neighbor's dog through a chain-link fence, they are for sure at risk of exposure.
And this brings us to the most dangerous part, the sneaky spread. Step 1 is exposure. Step 2 is this incubation period lasting 2 to 14 days. During this time, the dog looks totally healthy but is highly contagious, unknowingly spreading the virus everywhere. Step 3 is the peak onset of that terrible cough. This is such a powerful talking point. Tell them, merely avoiding dogs that look sick is not enough to protect your pet, because dogs spread this disease days before they ever start coughing. That is exactly why this vaccine is so critical.
Section 5. The herd immunity shield.
For those clients who are still dragging their feet, shift the focus from individual health to community protection. Herd immunity is essentially a community shield. Because vaccines have been so successful, some owners mistakenly think these diseases are just gone. They're not gone, they're just being held back by this collective shield. When vaccination rates drop, we see these terrible illnesses roar right back. So here's your final, really powerful script. By vaccinating your dog with these core vaccines, you aren't just protecting your own best friend. You're holding up a shield that protects the weakest, youngest puppies and the oldest, sickest dogs in our community who literally can't get vaccinated.
So I'll leave you with this to think about. Are your clients seeing vaccines as just some optional add-on, or are they seeing them as a vital shield for their pet and their community? By using these structured talking points, explaining core versus non-core, framing safety with real data, using vivid case studies like kennel cough, and bringing up the herd immunity shield, you can absolutely change the compliance narrative in your exam rooms. Get this toolbox into your team's hands, step into those rooms with confidence, and let's keep our patients safe. Thanks so much for joining me